My name is Jesse, and this is the sub-Q injection. First, I have my doctor's orders. I will take it and compare it to the patient's orders. Today, we will be giving 5,000 units to Mr. William Smith. As I'm comparing it to his records, I will notice any allergies, any reasons as to why not to give this order. I will then come to my cart. If I feel that the order is necessary, perform hand hygiene, unlock my cart, pull out the necessary equipment, and Mr. Smith is kind of on the heavier side, so we'll be using a longer needle. We will be taking the 1 mil 25 gauge 5/8 needle today. We'll also be doing 5,000 units of heparin out of an ampule. I will also need some gauze in order to break my ampule, an alcohol swipe for the patient, and another pad for dabbing him off once we're done. I will then grab my syringe, open it away from me, open it away from me. I will also need my filter needle so no glass goes into the patient. I will put that onto my syringe, throw away any necessary equipment. Before I even do any withdrawal, I will make sure that the medication is the medication I need. Heparin, 5,000 units. Patient, William Smith. Route, we're going to be sub-Q, amount 5,000, med, and time today. So everything checks out. I will then grab my gauze pad. Throw away. I will take my ampule and break it away from me. Discard right away into the sharps container. I will then take my syringe that has my filter needle. And 5,000 units is 0.5 milliliters, so I will invert my ampule, insert the syringe without touching the sides, and pull out the necessary amount. Again, the filter needle is used so no glass is put in. I will withdraw a little bit more just to make sure that we have the necessary amount. I will cap. I will throw away the ampule into the sharps. I will tap out any air. There it goes. I will then put on my other needle because we do want to make sure that the 0.5 mLs is in the needle tip as well so the patient gets the full amount of medication.
I do not want to massage the site.
Throw this away, but due for the fact that I'm going to need this for class, I will just set it off to the side. Pulling the needle out using sterile technique or aseptic technique. I will then make sure that the right amount is coming out of the needle, and I have. So again, I will check 5,000 units, 0.5 milliliters. I have the right patient. I will mark that on the syringe. The right med, the right time, and the right route, sub-Q. So I will lock up my med cart. Again, throw away any necessary equipment. I will grab everything else that I need, the MAR and the rest of my equipment. I will then I will introduce myself to the patient. I will close the door. And as I'm introducing myself to the patient, I will perform hand hygiene. I will ask Mr. Smith his birthday. I will ask him to spell his last name. I will then also put the MAR up to his wristband just to make sure that we have what we need. I will then talk to Mr. Smith about the reason why he's getting his injection. He's getting 5,000 units of heparin for the fact that he's at risk for blood clots. I will ask him for any tenderness, just so I can stay and avoid those sites of injection. Today we will be doing the abdomen. I will elevate Mr. Smith to a comfortable working height. I'll also check and see if there are any allergies that Mr. Smith has that I should be aware of, seeing as how there are no bracelets and there's nothing in his chart. I'm pretty confident that there are none. I will put on a pair of clean gloves. We'll lower the bedside railing. Again, I'm going to check the MAR and my med. Heparin 5,000 units today, Mr. Smith, and sub-Q. I will then take my alcohol swipe, throw that away. From in to out, I will go in a circular motion, and I'm going to try to stay 2 inches up from the belt line and 2 inches over from the umbilicus. Just because you don't want any rubbing of any sort, I'm going to let that air dry. I'm going to uncap my syringe, discard in the sharps. I will then pinch, bulk up, and seeing as how I got the larger needle, I will come in at a 45-degree angle. In a quick dart-like motion, I will release the skin, and within 10, I want to go within a milliliter every 10 seconds. I'll then pull out in the same angle that I went in, throw away in the sharps container, but again, due for the fact that I'm going to need the syringe, I'm just going to recap it for safety issues. I will then dab the area dry, tell the patient not to scratch or poke at it because we don't want any bruising of any sort. Discard that. I will then take off my gloves, lower the patient after I raise the bed rail. Cover the patient as well. Tell the patient that if there is any issues, any inflammation, any itching, any swelling, to use the call light. I will come back to reassess the patient in a timely fashion. I will perform my PPE, or I will perform my hand hygiene. I will then take whatever is necessary with me out the door, and I will document in the book saying that I did give the injection. And that is my sub-Q.